This video is designed to give healthcare providers information on how to enroll a patient into the Emergency Health Services Special Patient Program, or EHS SPP. The SPP makes unique care needs and goals of care known and accessible to paramedics responding to an emergency call. Any healthcare provider tasked with the person's usual care may enroll a patient into the EHS Special Patient Program by completing and submitting the enrollment form. The form is a fillable PDF and is available on this website page. First, download and save the form to your local computer. Please complete the form in discussion with your patient, their family, and/or caregiver. To begin, please check off New Enrollment or Update at the top of the form. The first section of the form includes basic demographic information about the patient and their care team, as well as their current and past medical history. Next, please indicate what the patient and family would want if they go into cardiac arrest. This may include that either paramedics attempt full resuscitation or allow natural death and do not attempt resuscitation. If no answer is provided, paramedics will attempt a full resuscitation. This section describes goals of care. You can only select one category. Full, or F1, aims to control or cure the illness and prolong life by all medically effective means. EHS would use all tools available for full resuscitation. For example, intubation, intravenous medication, cardioversion, and usual transport to hospital. Selective means the patient would want treatment for reversible conditions. This category is broken into S1, which includes intubation and CPAP, or S2, where CPAP is considered, but no intubation or other aggressive airway management would be undertaken. Comfort means a focus on the control of symptoms. C1 includes interventions like oxygen, suctioning, etc. C2 is focused on medications and other non-invasive efforts for symptom control. All the boxes under a selected designation are automatically checked off. You may uncheck any listed intervention as appropriate. Special requests or exceptions can be documented in the Unique Care Instructions text box. For transportation, normal EHS transport policies apply, unless there's a rationale for something outside of the policy, such as pediatric request for transport to the IWK Health Center, or special arrangements at a particular hospital for a palliative admission. Preferences on location of care and death can be documented as either home or hospital, and EHS will do its best to fulfill these wishes. Please check Unknown if preferences are not yet known. The form concludes with a checkbox affirming that it was completed in discussion with the patient and/or family, as well as a checkbox allowing the care plan to be shared with hospital emergency departments. Please submit the form electronically using the Simple Forms service. This is the only way the form can be submitted. You may access the Simple Forms service using the link provided. If you do not have the link, please contact the SPP administrator. The email address is provided on the bottom of the SPP enrollment form. Once received, the form will be reviewed and approved. The patient will be mailed an SPP card indicating their special patient number. Should the patient's condition, care needs, or goals of care change, submit an update. To do this, please check off Update at the top of the enrollment form. Include the patient's SPP number, name, birth date, health card number, and the requested change, as well as the contact information for the provider submitting the update. If a patient dies, please contact the EHS SPP Program Administrator. If you have any questions, please contact the SPP Administrator at specialpatients.ehs@emci.ca or 902-407-3271.